1 in 5 American adults have suffered or will suffer from mental illness. But those people are struggling to access the services they need, and the pool of psychiatrists who prescribe critical medication is shrinking every year. The shortage is directly impacting families like Kimberly Berry's, whose 2 daughters both suffer from anxiety. They're one of millions of Americans who spend countless agonizing days searching and waiting for psychiatric care.
When you can't get access to the people that can help you, it's so defeating, and it's so isolating and frustrating.
So we found in our reporting, one of the main solutions is building a bigger mental health workforce across the board. One way to fill the void, psychiatric mental health nurses. In 21 states and Washington, D.C., advanced practice nurses can treat, diagnose, order tests, and prescribe medication without physician oversight. Oregon and Washington are 2 of those states.
I got into it because I'm passionate about human nature.
Diane Solomon is helping fill the mental health care gap.
Yep.
A psychiatric nurse practitioner who sees patients in her practice every day.
I do psychotherapy as well as medication management.
Diane can diagnose and treat patients without physician oversight.
Hi.
And prescribe medication.
Come on back.
Across the nation, the demand for mental health nurses like Diane is soaring. And they're stepping up to help meet the need. In clinics, hospitals, primary care, public health, through telemedicine.
How are you feeling?
With the exception of yesterday, good.
Experts say the role of psychiatric mental health nurses needs to be better recognized.
And what else has been going on?
So Americans can get quality mental health care and substance abuse treatment.
And how's your anxiety been?
Last night, not that great.
We need to be asked to the table. Anything particular that you've been anxious about?
There are limitations, though. Like many other mental health providers, Solomon doesn't treat certain severe mental illness at her private practice in downtown Portland.
There are things I will not do in my office here as an outpatient office. Some people need definitely a higher level of care.
She doesn't take Medicaid or Medicare like many other providers.
I support my family, and I can't afford to take Medicaid and make that living.
Because the reimbursements are so low.
Because the reimbursements are so low.
There aren't enough nursing programs or training focusing on psychiatry, while the growing pressure to attract more people to the field mounts and the need surges.
The programs that we have cannot train people fast enough.
So to meet the need, Solomon says we need to start treating mental health as we do physical health, to piece together the holes and close the gap. One way of doing that is to embed mental health workers like psychiatric NPs in primary care settings.
We all need to be collaborating and forming interdisciplinary teams when everybody is an equal player in the patient's care. How have you been sleeping? This is a critical need, and unless we really answer the call in society, we're not going to have a healthy society.